Hello, Gary Perkins, HCPC paramedic and director at Sussex First Aid Courses. This is a second update regards the current problem with the shortages of adrenaline 1 in 1000. A couple of weeks ago I gave a bit of an update regards EpiPens, MRAID pens, etc. and they are mainly used by carers in the community. Today, however, this update is for dental healthcare professionals, and the Dental Care Chief Medical Officer has just released an update and sent it out to dental practices. And this is to basically say to you, let's conserve supplies. So many dental practices have the EpiPen or MRAID pen, so you may be very used to having one of these there. Or the MRAID pen, and we've traditionally talked about using them as first line, so we may use them. That buys us 5 minutes, and then we go on to our next dose, which means using the ampoules and syringe. Now, what I'd like to say is, in the event of an onset of anaphylaxis, first things first, stick to the basics, lay the patient down, raise them legs, apply oxygen therapy. Now, with the new update, they're saying use your adrenaline 1 in 1000 ampoules. So each dental care practice, healthcare provider should have a rescue ready pack. Ideally, your rescue ready pack will look something like this. It may just be in a clear pouch, but as long as it has all you need inside, and we're going to talk about that very shortly. In your rescue ready pouch, when you open it up, there ideally should be all your medication laid out. Also at the top, don't forget, have your signs and symptoms, your protocols, the drug dosages to relieve any stress that may be involved. Once you've diagnosed and you believe it is anaphylaxis, ensure you've called for help and then carry on with the administration. Now, inside your rescue ready pack, you should have ampoules. These are ampoules of water, because today I've got no adrenaline with me, so I'm just going to show using ampoules of water for demonstration. So you should have a pack inside your rescue ready kit, followed by a snapper, ideally for following best practice for breaking over the ampoules. I know over the years many people have used their hands and fingers and then they get cuts or a bit of lint, but ideally we should have a snapper there. Followed by that, we need a draw up needle. Ideally with the red draw up needles is because when we draw up the adrenaline, if there was any breakage of glass, there's a filter inside and we reduce the risk of needle stick injury. So ideally best practice, a draw up needle. Followed by a 1 ml syringe. Now in many practices, care environments, when they have their rescue ready kit, they often have a 5 ml syringe or a 2 ml syringe or even a 10 ml syringe. Well, if you're trying to draw up an appropriate dose for a 2-year-old, 4-year-old, 6-year-old, and it's only 0.3 milligrams, you try drawing up 0.3 milligrams of adrenaline in a 10 ml syringe. It's pretty tough. So ideally you should have a 1 ml syringe, because in your ampoules is 1 ml of fluid, so it's much easier to gauge. So the advice is, at the moment, conserve our supplies. So they're saying do not order any more EpiPens or MRAID pens, or hold back if you can if your supplier has none. But you should have in your kit, as healthcare professionals, also the ampoules. The ampoules, yes, take a bit more to involve to draw up and get ready, take a bit longer. But don't forget, you're there on scene. Yes, you've called 999, but you're way ahead of the game for when the ambulance gets there. So take your time, work with a colleague. First things first, grab your adrenaline ampoules. Take it out of the pack, have a quick look and check the dose, check the date, etc. Once you've done that, you need to safely open it. Now, if you just have a look at the ampoule there, traditionally, as you can see at the top, the medication is always there, and people often flick it, but all you need to do is turn it around and the medication would drop down. Now, on the ampoule itself is a little dot there. Ensure that dot's facing towards you. If it's to the side, diagonally, indifferent, when you break this ampoule, often it will shatter. So have it towards you. Grab your snapper from your kit. Some of you may have like a blue plunger that you just plunge on top, or a clear plunger. These are reusable, so we just pop it on the top there and snap away. And there it is, inside safely, followed by your ampoule now ready. Now, grab from your kit your red draw-up needle. This red draw-up needle, again, as I said, is blunt. It has a filter, and the whole idea is you can now just pop it inside, and with your 1mm syringe, pour up, or draw up, I should say, the appropriate dose. So I'm just dealing with an adult at the moment, and I know for an adult it's 0.5 milligrams. So here we are, we're drawing up 0.5 milligrams. Once you're there, take it out. Yes, you can just quickly disperse any air, etc. There we go, to the top, and we're almost ready. Check the dosage with your colleague, safeguard yourselves and your patient at all times, and now you need to grab the needle for administration. Currently we're using the blue type, which is 23 gauge needle. Pop it on top, and there you are, ready for administration. Your patient is probably displaying signs of flushiness of the face, maybe itchiness, maybe swelling. It's now time to administer your adrenaline. So grab the adrenaline. Ideally, we need to go into the upper part, midline of the arm here. IM, always IM, never IV. Intermuscular, midline, or it may be down into the thigh. Midline again, intermuscular. Now you're in a care environment, so ideally you should be going to skin level. With EpiPens, MRay pens, we often talk about, yes, you can go through the clothing, but here in a clinical environment, let's go to skin level wherever possible. Midline then, do not hold the top, guys, and go in like so. Hold it like a bit like a dart. Ideally clean the area, steri-wipe if you have time. Best practice again, into the midline. There we are, and now you can inject your 1 in 1,000. As you take it out, it does pay just to keep the skin pinched together, to be honest with you, just for a few moments. After then, just massage it for 10 seconds. At this point now, you really should be watching the clock. Reassuring the patient, ensure oxygen litres is delivered at 15 litres, watching for any deterioration, and get ready your second dose in 5 minutes' time. If that patient is deteriorating, no improvement, again administer a second dose and keep going. As you may have heard me said before, if the patient goes into cardiac arrest, then stop administering medication and start your chest compressions, ventilations, and of course defibrillation as soon as possible, and update the 999 providers also. So, just to summarise, the current situation is, yes, there's a shortage on EpiPens, MRay pens, auto-injectors. Currently they're saying the ampoules are okay, we have supplies of them. So for the dental practice, healthcare providers, we should hold back from ordering EpiPens, MRay pens, auto-injectors, because we need to allow the community, the carers, etc. to have access to them. We as healthcare professionals should be using adrenaline 1 in 1,000 ampoules. So ensure then your kit is rescue ready. Ensure you know your drug dosages. Make sure there's easily put together, identifiable, and if in the event of a medical emergency, anaphylaxis, do not hold back. Lay them down before they fall down. Raise the legs to improve the blood pressure. Oxygen therapy at 15 litres per minute. 999, grab your kit, take your time, safeguard yourselves, check the dosages, and administer. Do not hold back. I hope that's been of help to you. It won't be word perfect. You can go to the UK Resuscitation Council for further updates on adrenaline. Of course, you can contact me, no problem. Please do share this to other dental care practices. It is mainly for the dental care practice because that's an area I work in often, but all healthcare professionals are actually facing this challenge at the same time. So thank you again, and I hope to give you another update as soon as I can. Cheerio, Gary Perkins.